More people can now get vaccinated in Johnson County, Kansas. Good evening, I'm Haley Harrison. KMBC 9's Jackson Kurtz explains who's on that list and why some of you are still waiting to hear when it's your turn.
Take your time, okay?
It's about getting vaccines into the arms of as many people as possible.
Come on in.
Johnson County is moving forward with phase 2 of its COVID-19 vaccination plan, adding people 65 years and older and K-12 special education teachers who could all get their shot this week.
Our special education teachers and those students tend to have to be quarantined quite a bit because of the inability for some of the students to mask and mask well.
Answering questions during a virtual town hall, county officials say thousands have filled out their vaccine survey, but many people still haven't heard back from the county.
Your friends and family maybe have reached out and filled out that form, and you're confused because you haven't heard back from us and you didn't get an appointment last week. We know and we have your information, and as soon as we identify when those clinics are going to be, we will reach out.
The health department says this week it'll also be working with county health partners to administer the vaccine.
Beginning this week, partners including Advent Health, Oleta Health, KU Med are assisting in vaccinating in the 65 plus category.
Flooded with calls about the vaccine rollout, Johnson County is adding contractors to help answer any questions about the rollout process. In Johnson County, Jackson Kurtz, KMBC 9 News.
Officials say that you only have to fill out that vaccine survey once. FEMA, the National Guard, and a drive-through clinic are all possible ways to get out the new vaccine. Several hospitals across Missouri have been chosen to distribute the majority of the vaccine supply to the state. Here are some of the participating hospitals in our area. Now, the amount they receive will be based on the regional population, and the Northland Hospital leaders are partnering with Cerner to designate a mass vaccination site.
Once the vaccine supply begins to flow more freely, you'll see the capacity at this dedicated site increase.
The state receives about 76,000 doses every week. Half will go to select hospitals. Nearly a quarter will be devoted to mass vaccination events. The rest will be divided up among local public health agencies, federally qualified health centers, and community providers. Let's take a look here at vaccines in the United States. Both Kansas and Missouri are lagging far behind. The national average is 9.4 doses per 100 people. Kansas is at 7.6 doses per 100 people. Missouri's at 7.2 doses. They rank 52nd and 53rd among all other states and territories. Tonight, 241 new cases of COVID-19 and 1 new death reported. That's in Kansas City, Missouri. That is since Friday's report. It's a little less than half of the total number reported across our 9-county area. The average number of daily new hospitalizations is also still dropping. An air traffic controller tower in the downtown Kansas City airport was closed for cleaning tonight. A COVID-19 case was reported today at the Charles E. Wheeler Airport. Air traffic controllers from another tower controlled the airspace while that cleaning took place. While COVID-19 remains a very big threat, doctors are seeing fewer cases of influenza and RSV than any other time in the last 7 years at least. KMBC 9's Brian Johnson reports on what's driving those numbers to record lows.
At the University of Kansas Health System, pediatrics has the fewest number of respiratory cases in years. The reason? Masks and social distancing.
This has been a year that we have never seen anything like this in a very, very long time, which is exciting.
Dr. Michael Lewis is the medical director of inpatient pediatrics. He says there's really only one other factor: zero tolerance for runny noses in public places.
Daycare providers or preschools have a lot more confidence in calling the parent and saying, your kid can't be here right now.
RSV and the flu are at 7-year lows.
It's those other interventions that we're doing, those other mitigation strategies that are really having a synergistic effect.
While many are tired of masks, they've saved lives, and not just to COVID-19. Many doctors say even when we're past the pandemic, many people might keep wearing masks, especially during winter.
I don't see masking truly really going away.
We know that some of the Asian countries were really good and have been doing masking for a while. Now that's because some of the Asian countries were hit with SARS initially, and so they didn't want to go through that again.
After experiencing COVID-19 and seeing a drop in flu and RSV, it's possible some Americans might feel the same. Brian Johnson, KMBC 9 News.
Now, doctors say that if you haven't, you can still get your flu vaccination, and they recommend getting the COVID vaccine as soon as you qualify.